Hi, everyone. Thank you all so much for coming and joining us tonight for our Medication Safety 101 webinar. Tonight, we're going to be talking about top tips for ensuring proper use and disposal of prescriptions in your community. So I'm really excited to have you all here. My name is Tia Belvin. I am a fourth-year student pharmacist at the University of North Carolina. I'm also the National Operation Substance Use Disorders Liaison on the Member Engagement Standing Committee. So if you have any questions as we go through the presentation today, feel free to drop them in the chat and please mute yourself. If you want to speak up and ask a question, we are going to have a Q&A later on in the session. So first thing, we just want to thank our supporter, Walmart, for supporting our Operation Substance Use Disorders. And I'm going to go ahead and introduce our first speaker today. We have Dr. Tom Franko. He's a 2011 graduate of the Philadelphia College of Pharmacy, completed a PGY1 residency at the Wilkes Veterans Affairs Medical Center. After residency, he developed a pharmacist-run medication therapy management clinic focused on chronic non-cancer pain at Geisinger Medical Center in Danville, Pennsylvania. So Dr. Franko joined the faculty at Wilkes University in 2013 with a focus on pain management and substance use disorders. While at Wilkes, Dr. Franko authored several papers on innovative education methodologies for pain management, opioid use, and pharmacist involvement with naloxone. He is the advisor for the Wilkes chapters of ROCI and OSUD, faculty liaison for SARPH, which is the Pharmacist Recovery Program for Pennsylvania, and was named a Cardinal Health Generation RX champion for Pennsylvania in 2018. He is current coordinator for the Pain, Palliative Care, and Addiction SIG group for the American Pharmacists Association, is no longer the coordinator, but is still involved in APHA. And he also is the Region 2 counselor for ROCI and just finished up his presidency term for the Pennsylvania Pharmacists Association. So we are really excited to have him here today. And I'm going to go ahead and pass it off to you.
Awesome. Good evening, everybody. It's great seeing all of the schools popping up. I see schools I know. Jeff, way to go. I saw Duquesne earlier, but we have people from all across the country. So it's awesome to be here. And I'm always excited to talk about anything with Operation Substance Use Disorder, especially with students, kind of share about why we're doing what we're doing and highlight a little bit about what we at Wilkes are doing, as well as just talking generally about leadership development as part of this. Many of you are involved with Operation Substance Use Disorder in probably a leadership capacity. So sharing a little bit about how you can develop your own leadership skills as you start to get ready to get out into your careers. All right. So I think leadership lesson 101, anytime you want to do something, always start with your why. Never worry about the what. Why is always the beginning, whether it's why you want to run for president. That's what I just got done finishing up, or why you want to do a project, why you want to apply for a grant, why you want your school to sponsor something. Always start with that. So the why behind all that we're doing right now is based on this national data, because we don't want to see people continue to die. That is what is happening here. And you can see that in between April 2020 and April 2021, over 100,000 people in the United States died from a drug-related overdose. And that is almost a 30% jump from the prior year. And that definitely had something to do with COVID. COVID didn't necessarily, it wasn't people catching COVID. With anything with addiction, addiction is a disease of despair. It is a disease of social isolation. If you've ever seen the movie Back to the Future, in that movie, when Marty McFly goes back in time and he has the picture of all of his siblings, and throughout the movie, all of his siblings disappears until he plays Johnny Be Good at the end. That is what addiction is like. Addiction wants to go after everything in your life first. And then when you're finally by yourself, that's when it comes after you. During COVID, it wasn't social distancing, it was social isolation. So all that stuff, family, friends, a social network, was taken away already. So addiction went right after all these people. So getting away from this notion that, as people, we could just live vicariously online. needs to go away. So that was one of the larger reasons, coupled with all the other environmental issues that are happening, such as wages and housing insecurity, job insecurity, inflation, food prices, all of that are being thrown on top of that isolation. Now, of that 100,000 plus people, about 75,000 of that were opioid related. So it certainly is going up, and there is no doubt about it that fentanyl is the leading cause of this, which is leading all of us to think that this isn't so much a prescription drug situation. Prescription drugs are still there, but in terms of the opioid-induced respiratory depression death rate, it's clearly because of a tainted drug supply of non-prescription or illicit products. Basically, people are buying what they think is cocaine, and it's fentanyl, or they're buying what they think is oxycodone, and it's fentanyl. You're probably seeing it on the news right now, rainbow fentanyl, that people are saying, oh, it's targeting children, which no, it's not. There is no evidence to say that rainbow fentanyl is intended to be targeted towards kids. If anything, there are certain dealers on the street that use colors to indicate certain product lines, but also those rainbow fentanyl tablets are virtually identical to their prescription, what they're looking like. They're a prescription oxycodone or a prescription alprazolam. And it's far cheaper to put a bunch of fentanyl in that pill than it is to put the actual product in that pill, because fentanyl's dirt cheap. So that's a whole nother tangent about how fentanyl got in here. But when you hear stuff out there, and that might be a great project for some groups listening, doing some mythbusters around passive fentanyl exposure, rainbow fentanyl, especially for first responders or for the general public, because Twitter's having a field day with this stuff, and it's just spreading a lot of fear. We are, though, seeing a rise of stimulant misuse. So cocaine and its cousin crystal meth are on the rise. We are seeing that, but it's not near what fentanyl is. But this is telling us that we're moving really from a opioid problem to a holistic substance use problem. The vast majority of patients who suffer from substance use disorder, at least 60%, suffer from a polysubstance use disorder. It's not a monosubstance use. So when somebody dies and they do a tox screen on them, they're not getting one drug. They're getting like 7, 8 different drugs, which includes nicotine and alcohol. So it's great. Everything we're doing with opioids is wonderful, and everything we should do to get naloxone out there and folks access to harm reduction and to buprenorphine, we should be doing. But as you start to develop more projects, don't forget about nicotine. Don't forget about alcohol. Those are out there too, and they are the socially acceptable addictions that people can have. So we want to make sure that we don't lose sight of those. In terms of actual medication misuse data, there's a really great resource out there, and it's put out, I believe, every year or every other year from SAMHSA, which is the Substance Abuse and Mental Health Services Administration. It's the National Survey on Drug Use and Health. And this breaks everything down: what products are being used, who's using them, age demographics, like the whole 9 yards. You need some good demographic data, this is the place to go. And it's all freely accessible. So the most recent one from 2020 says that over 16 million people have misused a mind-altering prescription medication, and that was in the last year. That was just through that year. So that was, barely scratching the surface of COVID. Over 9.3 million have admitted to misusing a prescription opioid, but over 10 million said that they misused a sedative or benzo. Over 5 million misused a stimulant such as amphetamine or methylphenidate, so a medication for ADHD. So it goes to show that a lot of the focus is on opioids, but more people have misused stimulants and sedatives, tranquilizers, benzodiazepines than opioids. So opioids get all the love, but there are other products out there. And a lot of people ask, like, well, if all these other products are out there, why do opioids get all the attention? Well, it's for a few reasons. Without question, the drugs that kill the most amount of people a year, nicotine far and away is number one. Alcohol is number two. Opioids come in at 3. Everything else kind of trickles down from there. With nicotine and alcohol, to die from nicotine and alcohol takes years. Unless, unfortunately, you are a victim of DUI, it's going to take years. Opioids, though, one time, one pill. That's all it takes. And that's the true danger. That's why it's getting a lot of attention. Most people that are dying from alcohol or nicotine are older. They've had a lot of other medical complications happen. Most people who die from drugs, opioids, or combination of opioids and other products are in their 20s, 30s. Really no other health conditions that chronic medical conditions when you think of causes of death like heart disease. Doesn't exist. So that's why we're seeing a lot of the attention being given here. Now, prescription medication misuse does not always lead to the development of a substance use disorder. And when you look at the numbers, and this is pretty consistent throughout the years, even dating back, only about 8% of people who misuse prescription opioids, I'm sorry, not misuse, who are on a prescription opioid, so you think like a chronic pain patient, will actually develop a substance use disorder. Now, 8% doesn't sound like a lot, but you need to put it into context that when you sit back and think about the fact that there are what, 320 some odd million people in the United States, and the United States uses about 97% of the world's supply of opioid medication, 8% is a pretty big number. It's a really big number. So that certainly is something that needs to be made aware. But on the flip side, you know that 80%, so 4 out of 5 people who misuse heroin or who have a substance use disorder, start it with a prescription medication more often than not for a legitimate medical purpose. So it's usually prescribed by a physician, or the other common way people get it, in fact, the most common way most people get it, is freely from a friend or family member who happens to either have it at home or stockpiling medication for that rainy day. You know, oh, I hurt my knee. I got a month's worth of oxycodone. I took 2 days. I'll keep it because, you know, I might hurt my knee again. So this is what's leading us to this whole discussion about medication storage and medication disposal. So kids is the other side of this too. You hear it a lot, especially with the rainbow fentanyl. You hear it. They're targeting our children, which again, that's a scare tactic. You know, yeah, you want to be careful with stuff, but there's nobody out there targeting children. It's just there's no empiric evidence that that's the case. But in terms of prescription misuse, yeah, it does happen. About 25% of kids feel it's okay to use prescription medications to study. Look, I remember being in school. It was wow, it's already been like 12 years, but it seems like it was not that long ago. And obviously all of you are in school now. I can, you know, the urge is there for a lot of people. Pharmacy school is not exactly easy, but this is like high school, middle school is what we're looking at, what this study looked at. And this is also from SAMHSA. This is SAMHSA-based data. To top that, about 30% of parents feel it's okay to use prescription stimulants to improve the academic performance in their kids, even if their kids don't have attention deficit hyperactivity disorder. So it's okay to give my kid methylphenidate if it means that they're going to do well in school. That's okay. And that is just a toxic situation that we need to get away from. The notice of a academic meritocracy that you need a 4.0 or 100 or anything to be successful. Take it from somebody who did not graduate with a 4.0. You don't need to have a 4.0 to be to make it in pharmacy, to make it in life. You don't. Here, 67%, so 2/3 of teenagers who misuse prescription medication in 2021 freely got that medication from a family member or a friend. So I actually heard this last line here from one of my students, that the most common cause of a substance use disorder is a medicine cabinet and not the street. Honestly, only about 4 or 5% of people who misuse medications started getting them on the street. The vast majority start taking it out of the medicine cabinet. It is the number one place by far that people can start doing it. And a lot of times the notion is it's safe. It came from a pharmacy. It came from a physician. It's okay to do. So it's all about education. And as we start seeing more and more, I just gave a talk to our nursing students yesterday about this. As we start seeing more and more grandparents play an active role in raising children, mainly because their parents are probably working because everything's so much more expensive now. So everybody's out working multiple jobs, trying just to maintain a household budget. You're seeing a lot of grandparents play an active role. Grandparents oftentimes take a lot of meds. So a lot of the times now it's educating grandparents to how to properly store their meds so grandkids can't get into it. You know, I have 4 nieces, 9, 7, 3, and newborn. The 9 and 7-year-old, they're chill, but the 3-year-old is at the stage where she's learning how to turn drawers into steps. So it's all about how to keep my parents' medications safe, because my sister and her husband both work. So that's part of the education, like, hits home. So we want to make sure that she's being safe too. So how can we get rid of this stuff? It's actually pretty straightforward. Both the FDA and the DEA recommend the use of a take-back box as the primary method to dispose of any unwanted medications. And you do have your take-back day. They usually have one in the fall and one in the spring. They have take-back day coming up on October 29th. So you can always find information about this on DEA's website. Just type in DEA Take-Back Day, Google it, and it'll pop up. But that is without question the number one way, suggested way of disposing of medications is to do that. Now, there are DEA authorized take-back locations available year-round in your community. Usually they're at some type of municipal building, so a courthouse, a sheriff's station, a police station. Some pharmacies have them, both chain and independent. Some do, but you can check, that's a hyperlink there. You can check that link and it'll take you to the DEA website. You just punch in your state, your zip code, little map pops up and all the little dots on it tell you where your local take back boxes are that you could do throughout the year. You don't have to wait for the take back days to do them. And one thing that, excuse me, one thing that we did, or I should say our former OSUD chair, I think he graduated 2 years ago now. When he was a student, what he did is he worked with our public safety office and Rite Aid to get a take back box placed on campus. So we actually worked with all of those agencies and have a take back box in our public safety office. We're located in downtown of a city. So in order to be more, continue being a pillar of our community, we wanted to offer that service to our community members. So any community member is welcome to come in totally free, dump their meds in it, and off they go. So that was a really great project and something that you can absolutely work on with your own schools or universities. So if a take back box isn't available, okay, let's say that maybe you live in a rural part of your state and there's just a whole lot of nothing that's around. As a Penn State fan, State College is in the middle of nowhere. There, it's farm for as far as the eye can see. What do you do in that case? Well, the FDA and the DEA have worked with the Environmental Protection Agency, so the EPA, to determine what the next best options would be. Because a lot of people do have concern of what's the environmental impact of disposing these? Or like, are we going to get the fish from The Simpsons with 3 eyes if we put this stuff in the river? Like, what's going to happen? So those 3 agencies got together and they have created a flush and do not flush list, which points out what medications are environmentally safe to flush down your toilet and which ones aren't. And that information is found at the hyperlink that's there. You can actually go and it'll tell you what medications are safe to flush and what medications are not. Remember that the take back box is number 1. If you can't do the take back box, use the flush list to determine if the medications are safe to be flushed down your toilet. Now, medications on the do not flush list have their own special recommendation as to how to get rid of them. Those are throw them out in your trash. Now, what is suggested by DEA is that you mix them with an undesirable, is the word they use, substance. I basically just call it, you want to make it icky, for lack of a better term, is what you want to do. So you can mix it with kitty litter. You can mix it with used coffee grounds. You can mix it with something that nobody's going to want to basically go through, is what they are suggesting. Additionally, anytime you dispose of any type of prescription bottle, you want to make sure that it's de-identified. So either rip the label off, Sharpie it, shred it. You just want to make sure that people can't dig through the trash and be like, oh, so-and-so lives at this address and takes these meds. You don't want that. So it is suggested that we can get rid of it. And again, more information is available. I link that information to the do not flush list for what DEA and FDA suggest is the preferred ways of disposing of those medications.
And just to add, these slides will be available to everyone after the presentation.
So getting involved in your community, that's like what OSUD is about. It's all about getting out there and providing education, because unfortunately the education that's out there for a lot of people is either A, lived experience, or B, Twitter. So we want to make sure that Twitter's great, but Twitter puts a lot of nonsense out there. So we want to make sure that we get out there and educate. Additionally, as pharmacists, you're the most trusted health provider that's out there. You're the most trusted, you're the most accessible. So people are going to listen to you. So we want to make sure that we use the power the public has given us to do the most amount of good that we can. And getting out there and breaking down these stigmas and these barriers is a great way to help open up treatment options for people who suffer from these conditions. Because the number one reason people don't go get help is that they don't know where to go. And number two is they're afraid to go. So if we can do something we might not be able to open up a treatment center, but we can do something about the number two stigma. Let's get out there and do it. Like we totally should. So things we can do. One, we can reach out to local law enforcement to inquire about teaming up for a take back day. So you have the one coming up on the 29th, reach out to your local police station. They're usually the folks who would be doing it. So reach out to them and be like, hey, can we help? Can we help facilitate? Do you want us to promote it? Find a way to partner. So we actually work closely with our county medical society to help facilitate this. So our county medical society, they're conveniently located right across the street from our campus. We've teamed up with them to go to our district attorney, to go to our U.S. attorney, to go to our local police department. And we send our students, they stand at the county courthouse, and it's like college game day. They're there with the signs, DEA Take Back Day, come on back in. And they collect tons of medications, like actually tons in weight of medications. So it's a great way to get involved. It's a great way to show that partnership with first responders. And you never know what can grow from that. You could think up other projects. You could think up other ways to collaborate. Like this is your foot in the door. So use that to your advantage. Partner with local pharmacies, chain or independent or independent, to distribute take back kits, to do disposal kits. So we worked with a local drug distributor for Pennsylvania to acquire over 1,000 medication disposal bags, which just contain charcoal. You put the meds in there. You put meds or liquids in there. It tells you how much can go in. You fill it up with water, you seal it, you shake it, and then you can toss it right in the trash because it's charcoal, so it'll deactivate everything. So we were able to get 1,000 of these bags. They didn't know what to do when like 5 of these giant boxes just showed up in my office one day. And what we did was we were able to provide them to local senior centers. We have a community outreach program that all of our students participate in once each semester with local senior center, I guess is the outdated term, area active adult center, I believe is the preferred term now. But we hand them out there. We also go to a lot of local school functions. So we do like the holiday fair or the Halloween fair, where there's a bunch of tables set up for kids to do stuff, but we're there to communicate with the parents. And we handed out 200 bags at one event just by doing that. But it's another great way to partner with your community and to get your foot in the door with drug wholesalers or drug distributors to try to identify ways to get these things at a reasonably cheap price. If you can't get in touch with a drug distributor, you can always just buy these things from their manufacturer, and you can look into getting grants or having your university sponsor or do a fundraiser for it. There's a lot of creative ways to come up with money to do this. And we have come up with ways to do that in the past, and I'm happy to talk about that if anybody would like. But lastly, let's use our social media and local media to promote safe medication disposal. So we have a radio, we have communications departments, we have radio. So for the last 2 years, we were doing radio shows. We're going to get more involved with social media about in addition to medication disposal, all things substance use disorder. Plus, we have a local media TV station like a block away from campus. So we're always over there, and they have a health beat reporter. And he's an awesome guy, and we always team up with him to do things about med disposal, some upcoming education programs that we have. We've worked very closely with them. We have a wonderful relationship. So if you have the opportunity to partner with communications department on campus or local media outlets, be it print, TV, doesn't matter, they will be welcoming to you. So all you have to do is just think creatively, think outside the box, and use that to your advantage. I think that's a real good opportunity to help promote not just OSUD, but to promote pharmacy, to promote what it is that we do, and to help spread the message so, we can help keep advancing what our profession's doing.
Absolutely wonderful. Thank you so much, Dr. Tom Franko. I did see that Kennedy had a question in the chat. And I just wanted to put this out there because I think that might be a question. I know a lot of the students that are in here might not be OSUD leaders, but maybe just a leader at their chapter involved in APHA. And so Kennedy's question is, how can, outside of our community engagement with OSUD, can you give us examples of how we can expand our reach and destigmatize, advocate / care for our patients in day-to-day at our various practice sites as student pharmacists and as future pharmacists, whether that's in community, hospital, or industry pharmacy? I was wondering if you could touch on that, Dr. Franko.
Yeah, there's a lot of different ways we could do it. So if you're not involved in OSUD, one, get involved with OSUD. I'll put a shameless plug out there so that we can have more and more students involved. And second, if you're looking for a great piece of education, the APHA Institute on Substance Use Disorders takes place out in Utah every year, formerly known as the Utah School. I 1000% recommend you go because we have discussions just like this, and you can actually network with other students involved with this particular topic out there. It is unlike any other conference, and I will shamelessly plug that all the live long day. As far as the question goes, what can you do? I think this is an opportunity where you can exercise, we'll call it small L leadership. So like big L leadership is like an elected office. Small L leadership is what you do on the daily, what you do day to day with the people that you work with. And I think you're going to work with other pharmacists, that's for sure, but you're also going to work with techs and pharmacy technicians. For as much as pharmacists do a lot of great work, pharmacy technicians are really the face because they're the folks who interact with the patient the most in most community, well, in all community pharmacies, and in the hospitals, they're the ones taking the meds to the floor, doing all the work there. So I think it's, yes, educating the pharmacists, but it's also going to be educating the techs who are there too. They're a part of our family. We want to make sure that we're training them. And I think it's going to be trying to institute a culture in your own pharmacy that supports destigmatizing substance use disorder. And the number one way to start that is to use the right terminology when we're addressing these patients. So for all of this information, by the way, you can find on the APHA opioid resource page. So if you go to the opioid resource page under clinical tools, I think it's like the third one down, there's a document called Let's Talk About Naloxone. A few years ago, some members of the Pain Palliative Care and Addiction SIG put this together. It's a one-page front and back document, and it has all sorts of different language on it as to what the preferred terminology is when we address substance use disorder. Some of the examples, though, we don't want to say addict or junkie or crackhead or anything like that. You want to say person with substance use disorder. You don't want to say they're clean, like, oh, this patient's clean. No, the patient entered recovery. The big one, though, that I'd say for right now, and I know we're pressed for time, but the big one, though, is overdose. So everybody out there remembers the 3 prime questions, what was it for and all that. So for overdose, let's listen to this one. So let's pick a medicine. Let's just pick hydrocodone. I picked on oxycodone enough. We'll pick on hydrocodone. So if I say, hey, as it relates to naloxone, we'll go with this. Here's this medication, hydrocodone. In the event you overdose, there's a medication called naloxone. That's a reversal agent. Would you like to hear more? So it sounds totally nonchalant, but in case you overdose, you're the reason that this happens. And addiction is based on an unhealthy level of shame. So if I am somebody with an addiction and I hear that I'm the reason that I overdose, it's my fault, that builds the shame. Or if I don't, I could feel like you're labeling me. So what the preferred term is in the context of patient counseling is bad reaction or breathing emergency. So to put that use, here's this medication called hydrocodone. In the event this medication causes you to have a bad reaction wherein you have a breathing emergency, there's a medication called naloxone. Would you like to hear more? And now do you hear the difference that the medication may cause this problem? It's not you. It's not your fault. It's not because you're a bad person. It's a side effect of this medication. It's just like saying lisinopril will make you cough and metformin gives you diarrhea. It's the same basic idea. In terms of diagnostics, when you're having a conversation with maybe your preceptor, if they say, oh, the patient's here because of an overdose, what we want to say with opioids in particular is opioid-induced respiratory depression. That's the preferred term. So the patient was admitted secondary to an opioid-induced respiratory depression. It takes that stigma off. It's going to take time. I won't argue. It absolutely is going to take time, but it's something we can do. We've done social change before, and we certainly can do it again. And that's a great way that you could start showing that small L leadership right at home.
Awesome. Thank you so much. Very motivating. I want to get out there and start planning things already. Yes. So Kennedy, yes. we answered your question, and then Elise, Elise put some resources in the chat. So if you guys want to go ahead and check those out. I do want to touch a little bit on the Institute Substance Use Disorders. That is a great conference that I know that I've always wanted to go to. I know in COVID we had it like virtual, but typically the application form for it comes out in January from what I remember, or early spring. And then the actual conference takes place over the summer, just for anybody that has not had or heard of it before. So they, I believe Elise dropped a link for it in the chat. So thank you so much, Dr. Franko. I'm going to go ahead and take over and talk about some logistics for DEA Drug Take Back Day happening later this month, as earlier mentioned. And then for those who have just joined or joined later on, I'm just going to reintroduce myself. My name is Tia Belvin. I am a fourth-year student pharmacist at the University of North Carolina. I am the National OSUD Liaison, serving on Member Engagement Standing Committee. I have previous experience as my chapter president, so any and all questions that you have, please feel free to send them my way. We are going to have a Q&A after we go through all of our speakers today. So if you want to unmute yourself later, you can go ahead and do that, but please stay muted during the presentation, and feel free to drop any questions in the chat as they come up. So I want to jump in. DEA Drug Take Back Day, as mentioned earlier, is October 29th. I have a QR code here for the DEA's website, go-to website for all of drug take back information that you need to know. So this happens twice a year, typically in the fall and spring. So there's typically one in April and one in October. So DEA Drug Take Back Day is essentially a DEA or government initiative where people can bring in their medications, but it's in association with your local law enforcement. So to actually become a site or become registered as a site for DEA Drug Take Back Day so that they can collect those statistics, and we can have law enforcement take those controlled substances and substances in general, that we have to register with local law enforcement. So when it comes to actual planning, I have some resources here for you all. So the first one is the one that I just recently mentioned. So that's the general DEA Drug Take Back website. Within that, there's also DEA Drug Take Back pamphlets, logos, anything like brochures, anything that you want to use to advertise the event. So if you are already planning the event, or if you have not started planning the event, this is super helpful. And this is something that you can get printed and put up at like a table, or if you want to put it on social media and stuff. It's really helpful to advertise the event and kind of like let the community know what's going on. And then I also have here a really helpful resource that I've used before. It's a FDA med disposals resource, and it has pretty much everything you need to know about how to dispose medications and kind of a rundown. It's very patient friendly, but it's also helpful for us as student pharmacists. And then for Operation Substance Use Disorders resources, it's always important to check out the OSUD website. Utilize that as much as you can as an officer. This has all the information that you need to know about OSUD statistics from the previous year, and then all resources. And then we have our general chapter officer resources, and that's where you can find our APHA, ASP logos, anything from the Dropbox, so like OSUD logos, like the most updated versions, different types of versions, as well as just other event guides and such. So definitely explore the chapter officer resources page if you haven't done so already. And then we also have a group me for OSUD. We have them for every National Patient Care Project this year. So if you have any questions about joining a group me, maybe you're not an OSUD leader, but you are for OTC med safety or something along those lines, please feel free to directly message me, and I will make sure that you can get onto the group me. But if you are an OSUD leader at your chapter, please scan this little QR code and join our group me, and I will let you in. And this is kind of like the most up-to-date information as we go throughout the year. And it's also just a platform to ask questions and bounce ideas off of each other for students from different types of chapters. So for preparing for medication take back events, we have a guest speaker today, Samantha Taylor. She is a third year student pharmacist at ETSU. So I'm going to pass it over to her, but I just want to say thank you so much for coming and speaking today. She has experience with actually planning and conducting these events. So I will pass it off to you.
All right, thank you, Tia. Good evening, everyone. I'm so glad you guys popped on for this webinar. So like she said, I'm Samantha Taylor. I go to ETSU Bill Gatton College of Pharmacy. I'm a third year pharmacy student there. And I have actually had a lot of experience with Operation Substance Use Disorders outside of pharmacy school. I'm from a small town in Southwest Virginia. So our faculty member who's in charge of our chapter at Gatton actually was planning a RAM clinic near the community college that I was attending for undergrad. And I was actually fortunate enough to get to go and work with those students there. And I just loved it and felt like I should continue it all through school. So I was involved a little bit with helping with just the Narcan trainings and stuff like that at the RAM clinics while I was at the community college. And then whenever I got accepted into pharmacy school, I was the P1 liaison my first year, and then I was co-chair my second year, and now in my third year, I'm the chair for our chapter at ETSU. So I also just wanted to mention that I did get the opportunity to go to the APHA Substance Use Disorder Conference over the summer in June, and it is really life-changing. Like, it is such a great experience. So if you're able to go, I know like with fourth years, rotations can kind of get in the way of that, but it's super, super great experience. So I would highly recommend that for anyone who gets the chance. So yeah, there's just a little bit about me. I don't really think I have anything else to add. Basically said all of it. So a little bit about why I feel like medication take back days are important. So basically, just what a medication take back day is, it's a program that offers patients a secure and accessible way and just an easy way to help prevent prescription misuse so they can turn in their expired or unused prescription drugs to local police departments or pharmacies for disposal. So it allows them to get it out of their cabinets or wherever they keep it, just so children or like a pet or anything like that doesn't get into it, and then they're not likely to go back to it. Like Dr. Franko said, sorry, I get emails all the time. Like Dr. Franko said, if they got it for a surgery and then they didn't use all of it, and then their knee flares up and they feel like they should go back and use it, if it's not there in the cabinet, then they're not going to go back and use it. So it's just a really good way to get rid of expired or unused medicines. So just a little bit about how to plan one specifically. So typically our chapter does the 2 national DEA drug take back days. So we'll do the one in October and then the one in April. But we have in the past done dates of our own that we just feel like would benefit the community. So just like some setting goals, it's really good to have a timeline for planning. So typically we'll get our faculty member involved, and then myself as the chair, and then the co-chair, P1 liaison, and then usually we get our APHA president involved. So we'll typically just have a meeting. We'll typically just have a meeting whenever, like usually it's around the summer, maybe July, late July, I believe is when we had it this year. So we just create a timeline for planning. So that's just basically when you want to begin advertisement, when you want to send out sign-up sheets, stuff like that. So with the advertising, I think I do have a slide specifically for that, but usually we hit it hard about a week before the event. So maybe like that Monday before the event occurs, just to like remind people But usually we do just like monthly reminders. So we'll start it in August. And then since this one is in October, we usually go pretty heavy with our advertisement, posting on social media and stuff like that. And then the next thing is just to select a date and time. So since we typically do ours with the National DA, we typically do ours at the police stations in our surrounding counties. So we don't typically have an issue finding a location, but once you have a date and time set, it's easier to be able to reach out to those local, if it's a police department or just like a local community setting where you can hold the event. And then you want to finalize the convenient location for the event. So like I said, police departments are usually our go-to. And then you'll want to create advertisement pieces. So we typically do flyers that will hang up in local pharmacies or funeral homes or just out in the community. And then we'll do social media campaigns. So we do a lot on our social media, like our Facebook, Instagram, Twitter, stuff like that. And then typically we do have a radio ad for our school. So basically it's a really great way to be creative and then just do some community outreach. If you have like local school systems or anything like that you can get in touch with, it's always a good way to have some community outreach based on your local region. And then organize qualified volunteers. So I have listed here some pharmacists, student pharmacists, faculty at the College of Pharmacies, and then other healthcare students. So typically we like to do collaborations with like the nursing students or other healthcare students that's in our surrounding areas and allow them to have a sign-up sheet as well. So typically it's more heavily nursing students, but we've had like physical therapy students or speech pathology students and stuff like that. So it's always good to be able to mingle with the other healthcare providers at this event as well. And then lastly, it's just spread the word, get it out. You know, if the community members don't know about it, then not many people is going to show up. And we want as many people to be able to dispose of their medications properly as possible. So spreading the word is a big part of it. And then next we have engaging the community. So basically the big thing is to spread awareness. So advertising is a big part of this, like I'd mentioned before. So the social media can make a big impact because there's a lot of people that maybe you don't know that like follow your Facebook page or whatever. But if I posted it on our Facebook page and then I share it and then my mom shares it and then her friends share it, like it gets a lot of people aware. And it's just really good to get the community involved in a very simple, easy way. And then also make it known to local pharmacies. So especially those with the medication take back lock boxes. Because a lot of our local pharmacies in Johnson City and the surrounding areas have those. So it's really good to get them to hang up posters and flyers and stuff in their pharmacies just to make the patients aware and stuff like that. And then when I was meeting with our faculty advisor, he actually mentioned to make it known to funeral homes. And I had never really thought about that before, but for, you know, people who just pass away, they don't have any use for their medications anymore. So it's best to get rid of them in a safe way and dispose of them properly than to just keep them in the medicine cabinet and save them for a rainy day. So that's always good. And then also just the local police stations, they're really good about letting us hang up the flyers and spreading awareness for us as well. And then it's really great to be able to build authentic connections with the community members during these events. So if you're non-judgmental, you kind of reduce that stigma and stuff like that, then a lot of the community members will keep coming back because they feel like they're not being judged or anything like that based on what medications they're bringing to dispose of and stuff like that. So it's really good to just, you know, be positive and cheerful and stuff like that to build those authentic connections with community members. So just some tips for a successful event that I feel like has always been helpful for us. Early planning is a big thing. So it allows you plenty of time to get all your details in line. It gives you plenty of time to find an event, find plenty of volunteers, and get the flyers and just social media things like that straightened out. And then stick to a budget. So we usually allocate a certain amount of funds for marketing materials. So if we do a radio ad or printing all the flyers and stuff like that, hanging them up in local pharmacies. So we usually try to stick to a budget. Sometimes we go over, sometimes we're under. So usually over the years it evens out, but sticking to a budget is really helpful. Networking with local businesses. So like I'd mentioned before, local pharmacies, whether that's a CVS or Walgreens or even independent pharmacies, they're always super supportive of what we're doing, and they really like to support the college as well. So it's really good to network with them, and then they usually will hang up flyers and like tell their patients, and then that gets a lot of their local patients to come to the event. And then creating a schedule or job for the volunteers. So it's really easy to help with the flow of how the event works. If you like kind of designate each volunteer to do a specific task, whether that be collecting the medications from the patients when they pull up, or if that's writing down numbers or separating out the medications, just whatever it is, having those tasks designated before the event starts is usually a helpful way to just kind of help with the flow of the event. And then lastly, always plan for challenges. The one that I did last year, it was pouring the rain, and it had not called for rain until the Friday before. So it was really unfortunate. Nobody wanted to be there. It was cold, it was raining, but we made the best of it. We put up a tent and everything like that. So just plan for challenges like weather or volunteer cancellations. Kind of always have a backup plan if you can, because that's always, it's frustrating when you run into challenges, but if you're prepared for them, then it's kind of easy to go on with the event. So I believe that is all I have. I'd be happy to answer any questions that anybody has. And I really appreciate Tia and everyone at APHA allowing me to speak on behalf of ETSU Gatton College Pharmacy.
Thank you so much, Samantha. I think all of those tips are super helpful, and you know, especially if you haven't planned an event before, or if you're just getting started, I encourage everyone to read through these PowerPoint slides, especially Samantha's tips, because definitely want to prepare for the weather. I've had instances like that, as well as like volunteers and everything. So thank you so much for sharing your insight. I know your chapter does wonderful things in the OSUD space. So thank you so much. And we are just going to open it up for Q&A. So feel free to unmute yourself or drop a question in the chat. If you want to turn on your camera, if you're feeling bold, like feel free, and please introduce yourself if you do unmute yourself. And just so everybody knows, Elise did drop the handout in the chat, so you guys can go ahead and download that. Okay, I see we've got one question in the chat from Michaela. For Narcan training, has anyone trained community members or first responders? I would say personally for my chapter, we have not done any community members or first responders. Has anybody else had experience in that?
We typically do a lot of RAM clinics. So that's patients who usually have low income or no insurance. So a lot of those are community members. And then for first responders, we have not, because usually when we reach out to ask if we could do like firefighters or police officers or the EMT, they've usually already been trained with their certification, so they usually don't want us to come.
excuse me, I'd say that we trained our public safety officers who are considered first responders. So we've trained all of them, and our fire chief is a massive supporter of naloxone use. He's very proud to say that they've given out, I believe it's somewhere over 400 doses of naloxone, like just last year. So we're not necessarily doing naloxone training with him, but we are doing other work with our local first responders. Um, so my advice would be reach out to the folks in your area and here are our services. And, some people are going to take it and some people won't, but the only way to know for sure is just to ask.
Like my next question is, I know every state has different naloxone guidelines and protocols. How did y'all get the Narcan? Did your state supply it, or did you have to buy it for the demo, for the training?
I was going to say for UNC, because we typically do trainings with other healthcare students, like graduate students, but we partner with our North Carolina reduction or harm reduction coalition, and they have a lot of kits, and we kind of put them together and then train everyone on it. So I know that we get a lot of our supplies from them. I'm not sure about Samantha or if anybody else wants to chime in.
We typically get ours through the local health department. So we kind of have an affiliation with them, and it's usually, since we're from East Tennessee, it's usually the Sullivan County Drug Coalition or the Tennessee Health Department.
Does anybody else have any questions? Okay, well, if there are no more questions, I just wanted to thank both Tom and Samantha again for speaking. We also want to thank our supporter Walmart for the continued support throughout the years. And the handout is in the chat, so please download that so you can reference our resources later on. And this webinar is also being recorded, so that recording will be available to everyone soon. Yes, thank you, Elise, for dropping that again in the chat. And if you messaged me your email, I will be emailing you soon about the GroupMes. Thank you everyone for your time, and thanks for coming out on an evening